I think one of the most important issues in health economics actually has to do with measurement. We don't have a very good overall measure of people's health. So sometimes I feel like everybody's looking at a different measure, maybe coming to different conclusions depending on what measure they're looking at. And we don't have a good, agreed upon, comprehensive measure. Also, an ideal measure would be appropriate for people's age. So you might want to have one measure for infant health, another measure for health of the elderly. And again, we don't have very good measures often. Another related issue is that when we do have detailed measures of health, we don't often have the ability to connect them with other types of data, like economic indicators or education, and so on. So that's also an issue. So I think that the things that would have the greatest impact on public health are essentially public health measures such as reducing pollution, which would have very broad effects and also probably benefit the most disadvantaged people. Anti-smoking campaigns would have a large impact. Making sure that everybody's immunized would have a huge impact. So I think those types of measures probably at this point have bigger impact on overall health than advances in medical care. So some of the things that have been extremely successful have to do with expanding health insurance to everyone. So the fact, for example, that most Europeans now have access to medical care is a huge triumph and has a very large impact on people's welfare. Given that that's happened, other types of campaigns like anti-smoking campaigns have had a big impact. Vaccinations have had a huge impact. We tend to, people are forgetting, and so now we have people who are against vaccines because they don't know what the diseases were like. But all of those things have had a huge impact on health. I think it's interesting that you asked that question because all of those things are already playing a big role in health economics. We have a number of people doing these studies using genome-wide association studies to predict things like body mass index. So that's been taken up very rapidly in the health economics literature. In terms of sensors, we have people doing pollution and health using sensor data that people are buying themselves and aggregating. Social media, there have been people doing studies looking at things like the flu, showing that Google searches on flu remedies are much more timely than official notifications about flu cases. Big data, I feel like I've been doing that for 20 years. So now, we have more sophisticated methods to take data sets that have millions of observations and come up with predictions. But in a sense, people have been doing that for a long time, and they're already taking things like Lasso. Everybody knows how to do that. They're using it regularly. So I guess one of the things that's astonishing is how quickly any kind of new technology for data science is taken up and used in the health economic sphere.